Okay, the dressing has been applied at this point, and now I'm going to clean the lines coming down from the dressing. So I'm going to come over here, and I'm going to open my swabs. This is my open swab that I just opened, and I'm going to go down with a clean gauze, holding each line, cleaning in a downward motion towards the end of the port, scrubbing them really well for each, trying to, again, scrub in a downward motion towards the end. At this point, I would get my caps, and I would get my alcohol swab. I'm going to be removing the old caps. I'll start with this one. Remove the cap, throw it away. I'm going to go ahead and clamp the line right before I remove the cap, so it's clamped off prior to me removing it. Now I'm going to open my alcohol swab, and I'm going to scrub vigorously for at least 15 seconds. So because that kind of popped off there while I was scrubbing it, I would start over as it touched the other ones. After about 15 seconds, I'm going to let that air dry completely. Then I will apply the new cap. At this point, I can go ahead and release the clamp. I'm going to take one of my syringes I had set up here, attach it to the site, to the port. Now I'm going to pull back. I'm looking for blood return. I want it to be brisk. If it's sluggish or anything of that nature, I would go ahead and make note of that as well. If there's any trouble pulling back or pushing any fluid in, I would stop at that point completely and not try and force it. Since I have a brisk blood return, I'm going to use the push-pause method. Using a 10 milliliter saline syringe, putting all 10 mLs into the port. I would go ahead and clamp it after I was finished flushing, and I would do the same with each line. I would cleanse, change the port, and I would flush using the push-pause method. At this point, I've done all of that. I'm going to go ahead and take my label that I have here, and I'm going to go ahead and attach that to my dressing itself. Now these need to be changed whenever they're soiled or every 7 days. So every week, unless soiled. And I would go ahead and label it with the date, time, my initials, the port itself, what it is, the size of the needle, the type of dressing, and so that that is all there for the next nurse when they're going to change it. I would remove my mask at this point and my patient's. How was that? Okay, thank you very much. If there's any concern, please let me know. And then I would also document in the patient's actual physical chart that I changed the dressing with the same information and how the patient tolerated. And that is your central line dressing change.